Good afternoon. My name is David Blackburn. I'm your Bell County Judge. We wanted to provide you with an update on a situation that developed late Friday afternoon. The Public Health District, Bell County Emergency Management Services, Baylor Scott & White, and the State Division of Emergency Management began a coordinated effort late Friday to respond to the situation at the Weston Inn Nursing and Rehabilitation Home in Temple, Texas. The coordinated effort that has taken place led to the retesting of several residents and staff, all residents and staff at that location. The residents had been previously tested prior to Friday. In fact, on I think it was May 16th, the facility had conducted COVID-19 tests on all residents and staff. And at that time, all residents and staff tested negative with the exception of the known positive. The facility has been monitoring and doing monitoring and cleaning efforts, but unfortunately the virus reintroduced itself, leading to new cases in the facility. As a result of the second round of testing that started this weekend, there are 24 additional positive cases that have been found. 14 of the 24 are residents, 10 are staff. So it's 14 residents testing positive, 10 staff members now testing positive. 6 of the residents have been hospitalized. All of these residents are now at Baylor Scott & White Hospital. One of those is an ICU. All of the residents hospitalized are considered high-risk individuals under the CDC and DSHS guidelines. We have also had, unfortunately, one death associated with this event, a female in the age group of 90 to 99, and she had underlying health conditions. Caraday Healthcare, which operates Weston Inn and Nursing Rehabilitation Center, issued a press release yesterday. Press release is available on their website, and I'd encourage you to go there to read through it. The point of contact for Caraday Healthcare is Kay Hirrell, Hirrill. She is the community liaison for Caraday Healthcare. Her phone number that she released is 254-534-5684. Again, that's 254-534-5684. And at this time, I'll turn it over to Dr. Chadwell from the Public Health District.
All right, good afternoon. Thank you, Judge Blackburn, for the overview. And I always apologize for looking down at the sheet, but I want to make sure that I get all of these questions. I got quite a few ahead of this, so I'm just going to go through them, and then I have a couple of other comments, and I'll see if there are any questions. So the first question, are any nursing homes currently closed? Other than the Weston, I'm not aware of any nursing homes that are closed, but they are regulated by the state and not by the health district, so they're not under our purview. Have all Bell County nursing home residents and staff been tested? Not yet. That is currently in the process, and more information may be following for that. How often are nursing home tested? They're tested on an as-needed basis, usually prompted by either suspected or confirmed COVID. And the testing is being done through a variety of means. So the state task force can be requested, and that's been done 2 or 3 times up to this point in time, I do believe. And there have been some instances in which partnership with local healthcare providers has been used to do this, and that depends on availability of testing reagent and staff and that kind of thing to conduct it that way. But those are the 2 most typical means of testing facilities. There has been 1 or 2 instances of facilities that decided to order and do testing internally. And how fast are the results received? It really depends on how the tests are conducted. Some results come in faster than others. It really depends on the laboratory and the methodology. And let's see, are these all nasal swabs tests or spit tests? So it depends on the patient and the kits that are available. So that's going to vary depending on a number of circumstances. The number of nursing homes in Bell County is 16 licensed facilities. And let's see, can you tell us about the second person who died? That was an individual in their 90s. It was a woman in her 90s. And there's a question here that indicates some confusion. We've only added 1 death to our count since the 3rd one that was reported in April. So there's only been the 1 recently. And let me make sure I've got all the nursing home questions covered. If there's follow-up testing, is there a procedure that will continue? Is it a practice that you're encouraging for nursing homes to keep testing? So again, testing is done as needed. And certainly if they feel that testing is necessary, we'll absolutely encourage them to go through whatever process they need to do that. And how many people are needing testing currently at the West End? There are 18 that are pending testing. Those are all either employees or contractors, as I understand it, and they will not be allowed to return to the facility until they've undergone testing and received negative results. What recommendations does the health district have for the facility and now that the virus has spread? We're recommending to take necessary precautions to isolate individuals who are positive, which they are doing. They have a COVID wing specifically designed for that purpose. And we are also recommending that they continue with their monitoring procedures for their employees and that they make sure anyone does not come to work with any signs or symptoms of illness, maintain that hand washing, use of PPE, and proper cleaning precautions throughout the facility. They actually had the Army National Guard in today to do a full decontamination of the facility because of this situation. And I think the rest of these questions are not related to the outbreak, but I'll go ahead and address them anyway. There was a question regarding positives at a Sonic or Applebee's, and I'm not aware of any cases associated with either location. So sorry, I don't have a good answer for that. Can you discuss the Bell County cases by date tested positive chart on the dashboard? What are those numbers telling you? It's telling me that the predictions that I gave previously about reopening and increased testing at healthcare facilities is about right. I think I stated somewhere in the neighborhood of 10 to 15 case spikes as a result of that reopening. More people moving around and more testing in hospital facilities was likely to occur, and that's about what we're looking at currently. And there have been over 100 new cases in the last week. How many tests were given in the last week, and are you concerned by the number of new cases? So it's been just in our local hospitals, about 2,500 tests have been run. And that's, again, just our local hospitals. That doesn't even include private labs. So that's a pretty good metric there when you're doing that much testing. 100 cases, I would like to see less. But again, that's quite a lot of testing that's occurring right now. And residents were gathering in crowds over the weekend. How do you think this, or do you think this may impact the spread in Bell County? Maybe. I'm not going to mince words, certainly may. Let me make sure I didn't miss any questions. You guys are really coming at me with questions today. Are you working with school districts on their reopening? So we do advise if there is a need for advice on how to proceed with school reopenings. We're certainly happy to help with that, and we've been helping with that, but they are overseen by TEA. So as far as how they go about that and what requirements they have, that's going to be something that TEA takes care of. Are there any questions? Did I miss anything?
Hey, Dr. Chadwell, it's Jacob from Telegram.
Hi, Jacob.
Hi. Can you kind of go over a timeline for Weston, kind of like day by day, what happened, just give us a better picture?
Okay, so on Friday, I know it was Friday morning, exactly what time, I don't recall, but we got a notification that there was an individual who had been hospitalized, who was a resident at Weston, and that individual was at that time in the ICU. And shortly thereafter, we got a call from the Weston themselves asking what the next step should be. So we started working with Baylor Scott and White and local partners to mass test them now that they had another positive. And shortly thereafter, later that afternoon, I want to say the next report of the next case came in about 7 o'clock. I think it was after our 2 o'clock update that day, we got another report. And between that evening and the following morning, we had 4 more, and we were notified of the fatality the previous night. So by the time we started initiating testing, we had 5. And then, of course, we were notified of results for the testing beginning on Sunday when we started receiving those results, with the rest of them coming in about 10 o'clock this morning.
How many total tests were performed at Weston?
I have that in my notes, 148.
Do you have any idea how the virus got in? Was it likely employees who got it, or?
It could have been any number of ways. It could have been someone who didn't realize they were sick. It could have been that early testing did not detect someone who would later become positive. There's a variety of ways that could have happened. Unfortunately, this virus is pretty sneaky. Anything else?
Dr. Chapel, this is Megan with KWTX.
Hi.
Are you aware if they will continue follow-up testing at Weston specifically?
No, I'm not aware that they're going to do more testing after this. I would assume, again, and this is an assumption on my part, that if there are any further positives after this mass testing, they may, but I'm not aware of any plans to do so.
Okay, and then on the press release over the weekend, it had said 17 residents and 7 staff members, but I think the judge said just now that it was 14 and 10. Do you know the exact number on that?
So it's 14 and 10. There was a little bit of confusion as to which positives were employees and which positives were residents, and we were able to kind of hash that out this morning and determine which fit into which group.
Okay, got it.
A lot of detail work in a short period of time.
I'm sure.
Anything else?
You had mentioned that Weston Inn had closed, but you weren't aware of any other nursing homes that closed. Can you just clarify what that means, that they're closed?
So they're not accepting anyone through the doors. I actually stopped there earlier today to drop off some PPE to help them out, and their doors are actually locked. No one is allowed in.
Okay, so any resident who was living there is already still inside?
As long as they're not in the hospital, yes. As long as they're not currently hospitalized, yes.
Going back to the numbers Judge Blackburn brought up, and that you brought up, Terra Day, I'm looking at a press release from them right now that says they had 18 residents and 9 team members. So that's 27, I think Judge had said 24. There's a little discrepancy there, I don't know.
It's entirely possible they've received additional notifications since our notes. These notes are, trying to think, it's been a couple of hours. This is an evolving situation. It's entirely possible they've received another notification since then.
I have another question on those numbers. There's a press release that Terra Day had put out, I believe it was last Tuesday they put it out, and I think it's dated for May 20th, that when they had that initial employee test positive, they tested everybody at the facility, but that 3 employees came back positive. But earlier in the press conference, you guys said that no one else had tested positive.
I'm not aware, and again, we've had multiple facilities like this mass test, so I'd have to look at the press release and sort that out, not to my knowledge. Any other questions?
Thank you, Dr. Chadwell. I'd like to add, again, I'm going to look Dr. Chadwell's way.